Hi, I'm Jenny Soini, licensed acupuncturist and owner of Valley Holistic Healing. Valley Holistic Healing is located in Rice Lake, Wisconsin and in Stillwater, Minnesota. At Valley Holistic Healing, we treat everything from low back pain to allergies. We use acupuncture and Chinese herbal medicine to treat these ailments. We also have an emphasis on empowering patients to become active participants in their healing through education. At Valley Holistic Healing, we are especially passionate about treating patients with fertility issues. 1 in 8 couples in the United States has difficulty becoming pregnant, and the rates of infertility have been steadily on the rise. Even a couple with no known fertility impairment has only a 20 to 25% chance of becoming pregnant in any given cycle. By being aware of my list of the top 10 things I wish every couple trying to become pregnant knew, you can increase your chances of becoming pregnant in any given cycle. And by being more aware of your body and tracking your fertility signs, if intervention is needed with either Eastern or Western medicine, you will be able to help your doctor come to a diagnosis and proper treatment plan sooner, something that's really important, especially for couples who are older. The first thing every couple needs to know involves their health. The process for an egg to mature and be released in ovulation takes 3 months, and sperm production also takes at least 3 months. If you want a healthy sperm to meet a healthy egg to make a healthy baby, you need to be healthy, and you needed to be healthy 3 months ago. Most women at least are aware that while they're pregnant, they need to avoid things like drinking and smoking and not getting enough sleep. But what they might not realize is that it's important to start those practices even before trying to conceive, and that it's also important for their partner to be doing the same. The second thing to be aware of is your age. It's true that the longer you wait to become pregnant, the more difficult it becomes. As I mentioned in the introduction, 1 in 8 couples in the United States has difficulty becoming pregnant. And if the woman is over 35 years of age, that increases to 1 in 4. And if she's over 40, it increases to 1 in 2. Some of our more recent research is showing that this is also true for men. Men over 35 years of age take longer to get their partners pregnant and also have an increased rate of miscarriage. These statistics are also true if the couple is not trying to become pregnant naturally, but is using a technique such as IVF. This is not to say that older couples can't become pregnant. They just might need to work a little bit harder in the diet and lifestyle issues. Also, couples waiting longer to try to conceive does not sufficiently explain the rates of infertility raising in the United States. It's actually the 20-something demographic that is having the most increased rates of infertility. Number 3 involves your weight. Roughly 12% of all cases of infertility can be traced back to weight, and it's split pretty evenly between being overweight and being underweight. If you are overweight as a woman, it can take you twice as long to become pregnant. And if you are overweight as a man, your chances of being infertile are increased by 50%. And if you're an underweight woman, it can take you up to 4 times as long to become pregnant. Number 4 is exercise. Regular exercise is a good thing. Many women and even some medical doctors are under the misconception that a woman should stop exercising when she's trying to become pregnant. This might be true if you're an extreme competitive athlete who is exercising for hours at a time. But if you're an average woman who's just doing 30 minutes of moderate cardio exercise daily, you're actually increasing your chances of becoming pregnant. Number 5 is sleep. A lack of sleep can lead to irregular menstrual cycles and also stop you from ovulating. Number 6 is to avoid toxins. According to the EPA, there are over 50 chemicals that are known to impair fertility, but only 4 of them are regulated because of it. In fact, sperm counts have been plummeting over the past several years, and environmental toxin exposure is the prime suspect. Here are 2 that I would like to share with you because they're so easily avoidable. The first one is dioxins. Dioxins are found in things like beef, dairy, milk, cheese, poultry, and eggs. A great way you can avoid dioxin exposure is to buy organic beef, dairy, milk, cheese, eggs, and poultry. Also, if weight is an issue, losing weight will reduce your exposure to dioxins. This is because dioxins are stored in fat, so the less fat you have in your body, the less dioxins you'll store. The second is xenoestrogens. Xenoestrogens are a chemical that are found in things like plastics and also in many of our daily hygiene care products. Xenoestrogens have an effect on fertility because they mimic real estrogen in the body and attach to estrogen sites. By doing this, they inhibit real estrogen from doing its job. And estrogen is a really important hormone when you're trying to become pregnant. A great way to avoid xenoestrogens is to be careful about how you use plastic. You don't want to store your food in plastic containers, and you especially don't want to heat your food in plastic containers. Also, when you're storing leftovers, you don't want to take leftovers that are hot and put them right into a plastic bag. The other thing you can do is pay attention to the labels when you're buying hygiene products. Look on the packages to see if these products contain things like phthalates or parabens. Phthalates and parabens are xenoestrogens, so it's best to avoid products that contain these items. Number 7 is to avoid caffeine and coffee. Consuming caffeine reduces the amount of blood flow to the uterus and makes it more difficult to become pregnant and to stay pregnant. Coffee, with or without caffeine, also reduces fertility. This is because coffee is very acidic. When you overconsume acidic foods and drinks, it can actually change the pH balance of your cervical fluid. Cervical fluid is the medium in which sperm swims through to get to the egg. If your cervical fluid is acidic, it can actually kill the sperm. Eating a diet full of vegetables and whole grains is a great way to ensure that your cervical fluid has the proper pH to support sperm. Number 8 is medications. You should consult with your doctor about any prescribed medications you're taking while trying to become pregnant. Some of them can do things like stop ovulation or even cause ejaculatory dysfunction. You should also consult with someone about the over-the-counter medications you're taking, even if you're only taking them occasionally. Some of these medications can also change things like cervical fluid and impede the ability to ovulate. Also, you should never use recreational drugs. Recreational drugs pose all the same threats as prescribed and over-the-counter medications, and then some. Number 9 is do not overheat your reproductive organs. This is true for men and women. Men and women trying to become pregnant should avoid things like saunas, hot tubs, and even taking really long hot baths. And for men, they should avoid doing things like wearing tight undergarments or tight bike shorts, or even putting their laptops on their laps. This is because overheating the testicles can cause damage or even kill sperm, and it only takes a couple of seconds of overheating. Also, remember, it takes 3 months for the man to regenerate and produce healthy sperm. So you need to avoid these things for the whole 3 months leading up to trying to conceive and the whole time that you're trying to conceive. And the 10th thing every couple needs to know when trying to become pregnant is to know when to have sex. Women are only fertile the days leading up to and during ovulation, in contrast to men who are always fertile. Ovulation is defined as a 12 to 24-hour window when an egg bursts from its follicle and is swept up into the fallopian tube. This only occurs 1 time per cycle. Occasionally it can happen twice, and that's how we end up with fraternal twins. Ovulation does not occur at the same time for every woman, and it's crucial for her to understand when it's occurring for her. You can learn your pattern of ovulation by doing things like tracking your basal body temperature and also your cervical fluid. The most important fertility sign to track when deciding how to time intercourse is to track the woman's cervical fluid. In fact, I think cervical fluid is the most important bodily secretion that's never talked about. Most women don't know how to monitor their cervical fluid to determine when it's fertile cervical fluid and when it's not. But through some really basic education, you can learn your body's pattern and know how to time intercourse for the most optimal day. In my experience of working with couples who are trying to become pregnant, even those who have been trying to become pregnant for years and have tried things like fertility drugs or insemination, aren't given this basic education on how their diet and lifestyle impairs or improves their fertility. And they're also not given the basic education on how to track the woman's fertility signs to improve their chances of conceiving. This is why I am so passionate about working with couples who are having difficulty becoming pregnant. It's my experience that once you have this basic education, you can become pregnant faster, cheaper, and safer. If you or anyone you know is having trouble becoming pregnant, please feel free to give me a call.